Joining us in studio is Dr. Joe Congeni, sports medicine at Akron Children's Hospital. And good morning, Dr. Joe.
How's it going, Tony?
Good. I'm just going to training camp tomorrow for the Browns, but other high schools and other places are going in for their own training camp coming up. I know a friend of mine who's a coach up at Brush. He said that there are certain ways you get around that with the OHSAA because you can't do two-a-days and they have to have a certain amount of time. So there's that spring camp they do, and then you start the training camp during the summer, but they're going early because they're able to have the luxury of going early because they cut their spring camp short. So it's just weird loopholes in the OHSAA, but everybody's getting ready. But it is going to be kind of hot this week.
Everybody has different schedules with it, and that makes it tough on us with the sports medicine team. We have 30 high schools and 2 colleges we work with some, and everybody's schedules are different. But everybody is gearing up next week, really, for fall sport. So the sports medicine teams are gearing up. We have training camp this week. As soon as I finish here, I'll be heading over to the University of Akron, and there's a room full of paramedics there, and the sports medicine team and the paramedics are practicing the things they do for some of the life-threatening, catastrophic things that can occur. Thankfully, in the course of a year, maybe it happens once or twice or 3 times, but the medical team needs to be ready, the sports medicine team. And really, when you think about it, Tony, if you could go to the training room with us, what the trainers and the sports medicine team have to do is they have to determine, okay, people have these injuries, our athletes. Is it routine where I can just treat the person for a while, and that happens very frequently, and many of those kids get better? Or is it one, hey, this isn't getting better, they need to see somebody, I need to get a consultation with a doctor or something? Or, hey, is this urgent where I need to call the parent, they need to go down to the emergency room tonight? Or the final thing, is this an emergency where I need to call the paramedics and pick up a kid? And at a typical high school, that may happen 2, 3, 5 times a year. But they practice these things. People don't know that it's important to practice. Last week we talked about heat. You get more than 30 minutes of heat stroke, these kids are not going to survive that. So the trainers and the medical team need to know what to do. The other things, there's other bad things. What about heart? We've talked about heart. You know what they have to practice for heart is get that AED out. Make sure that it's working properly. Practice with the AED. Do you know that in our area, Tony, in the last 6 years, there's been 3 cases where the AEDs have looked to save lives of high school kids when the training staff and the sports medicine team used the AED to restart the heart that had stopped. So they have to be ready for that. Have to be ready for neck injuries. You know, when you see the team go out and stabilize somebody's neck, when you think there could be a possible paralyzing neck injury. So this is things that people are practicing, and I'm going right over to Akron U after this to do that.
Yeah, and we're talking to Dr. Joe Congeni, sports medicine, Akron Children's Hospital. The name we've been hearing about, and you almost hear it more, not for what he did in his playing career, but how his tragic end was Corey Stringer. And back in those days, and I was playing football, I think I was playing, varsity or whatever it is when you're in 7th and 8th grade, and cadet football, and you're two-a-days. Long practices on Saturday. These practices are 4 or 5 hours. Two-a-days, you're getting there in the morning. Now you don't do two-a-days anymore, and a lot of it, and granted, Corey Stringer was with the Vikings at the time, but that kind of really set things in motion for how we're really training these kids and these young adults for football for this season. Are we wearing them out? And you were mentioning Corey Stringer last week, and that's still kind of the name that resonates in the sports medicine field. Yeah,
what a tribute to him that so many people's families say afterwards, family and friends, hey, we want to give back and do something really meaningful in the name. That was back in 2002, and now the Corey Stringer Institute studies every single case of sudden death or unexpected death or near death that occurs on a sporting field and figures out what can we do to prevent those things. So his name lives on. There's no question about it. And we need to learn from these things. I was talking last week about research. So they look at things related to head and neck and heart, and we have kind of a good plan in place. So I do want to tell people out there, gosh, I speak to the Akron firefighters, and that's where I'm going right after this. Many familiar faces down there. Many of these people were athletes 10 years ago out on the sporting fields, and we're in good hands. These are really good kids, young people that really want to do a good job. The paramedics are ready for that handoff from the sport medicine team when we have one of those emergent cases.
We'll continue this here in just a second. We're talking to sports medicine with Akron Children's Hospital, Dr. Joe Congeni, here on the Ray Horner Morning Show. Akron. We're talking to Dr. Joe Congeni from Akron Children's Hospital in our studio. And one of the things I wanted to ask you about, Dr. Joe, is nowadays this increasing of supplements are in our system.
Mm-hmm.
And I take them. I went to the gym yesterday, and I took this pre-workout supplement that I have. It gives me a lot of kick, gives me some energy, but it has creatine in it. And what I think a lot of people don't realize is that you need to drink a lot of water to make sure the creatine kind of breaks up a little bit. Otherwise, you're seeing a lot of these injuries in sports because they're not getting enough water as they're taking this creatine to build the muscle. And they're getting a lot more pulls and a lot. I mean, is this what's happening from what you've seen?
Yeah, I mean, you really want to make me a little bit anxious this morning, don't you, Tony? Because one of the areas we do worry about is supplementing in young athletes. Because, again, there's a couple things. Number one, we don't have great studies on supplements because of a thing, a Supplement Act of 1994, where these supplements can come out before they're very well studied. And sometimes we don't even know what they're going to do to our athletes. And young athletes may use too much. They think a little is good. They use more. Other issues like that. But you mentioned specifically supplements. And the other thing with supplements, so many different supplements may be in one product that people are taking. And so creatine we do have a good handle on. Creatine's been out there since the 90s. Creatine we have studied a little bit, and that supplement is very dehydrating. So you're exactly right. If you're going to use anything with a creatine in it, you need to hydrate greatly. Now, in the meantime, when creatine first came out, I remember those days, we weren't sure. We were worried about its effects on the kidney. And when creatine's taken in reasonable doses or amounts, it doesn't seem to be as much of a problem with kidney damage and other things as we were worried about. But the biggest thing we see in kids who take a lot of creatine, dehydration and cramping.
Yes.
Significant cramping. So when you see us go out and somebody with leg cramps, hamstring cramps, calf cramps, or even abdominal cramps, or I've seen the back muscles cramp, or total cramping called general tetany. Much of the time when we go back and start asking them, these kids are taking supplements. The ones we worry about the most are the ones we don't have much research on.
Yeah, that was, I remember in the 90s, my dad would take this stuff. It was called Hot Stuff. And it's since been banned from the market, and it was good. And what we're finding out is a lot of the quote-unquote good supplements that are out there have stuff you don't even realize. They're
That's
throwing
right.
everything but the kitchen sink in there. And I know I used to take a supplement called Jacked a few years ago. It was Jack with a 3. And the reason for it is they have what's called, I don't even know how to pronounce this. It's called 1,3-dimethylamylamine or something. I don't know. Do you know anything?
I'm not, specifically familiar.
But what happened was it's a substance in there that eventually got banned because it was giving people just their heart palpitations.
Heart palpitations and beyond. The big supplement that got banned in the mid to late 90s was anything with ephedra in it. Ephedrine was a stimulant, and they were throwing it into some of these things. It was one of the 3 or 4 supplements, and there actually were cases of seizures. Gene mentioned this morning abnormal heart rhythms. It would kick these young athletes into abnormal heart arrhythmias. Mm-hmm. There were cases of even sudden death of people on ephedra. So the FDA had to step in then in the late 90s and ban any of these supplements with ephedra. Now you know what people are using to try to get a stimulant effect is caffeine. So high doses of caffeine in some of these energy drinks and other things, but not ephedra as much anymore. Yeah, I still will occasionally see it being snuck into a supplement, but that's illegal. And when kids are tested, anything with ephedra in it is a banned substance.
And it will come up there. Well, thanks, Dr. Joe, for stopping by. We'll talk to you next week.
Yeah, the one other soapbox thing, let's get that netting at ballparks. Let's really push that. There's no reason right now for us to not have netting when you go out there. When I worked minor league baseball, much of what we got called to see were people that got hit by a foul ball. And in this day and age with it happening so much more frequently and so easy, 3 days it took to put it up in Chicago. Let's get netting in every ballpark.
I think it's going to happen pretty soon. Speaking of ball ballparks. The Indians lost last night to the 2-1. Thanks, Dr. Joe.
Thanks.